Hi, everyone. I'm Lorraine DeBono, the managing partner at FLG Partners, and I'm very excited today to chat about launching an IPO in a time of coronavirus. We're actually going to do a case study today of Angion Biomedica Corporation, and we're very lucky to have with us its CEO, Dr. J. Venkatesan, and our FLG partner and Angion CEO, Greg Curhan. So let me first introduce our guests to our audience. First, Jay is Angion's president and CEO. He is also a member of the board of directors of Alpine Immune Sciences, which he, by the way, co-founded and where he previously served as president. He is also a managing partner at Alpine BioVentures, a biotech-focused seed stage VC firm, and was the founder and portfolio manager at Ayer Capital, a global healthcare fund, and co-managed healthcare investments at Brookside Capital, which, by the way, is part of Bain. He received his MD from the University of Pennsylvania School of Medicine, his MBA from Wharton, and his BA from Williams College. Also with us today is FLG partner and Angion's CFO, Greg Curhan. Greg joined FLG in 2020 with 35 plus years of financial, capital markets, and strategic advisory experience as a CFO across diverse sectors, including medtech and life sciences, investment banking, internet, and clean technology. Greg has also served in CEO, president, and board of directors capacities. In fact, prior to FLG, Greg was CFO and Senior VP of Corporate Development of Providence Medical Technology, and he also founded and was president of Merriman Curran Ford, an investment bank. Recently, Greg was also appointed to the advisory board at Specific Diagnostics. So to both of you, welcome and congratulations on Angion's IPO. Phenomenal. So let's get started. So as you know, the market is hot for IPOs right now. And what I'd like to do today is really explore with you two what's different when launching an IPO in the time of COVID. So let's get started. First, Jay, you're up. Pleased to have you here. Thank you so much. And what is such a value is for you to bring today a CEO's perspective to our discussion. So you've been CEO of Angion since May of 2018. Tell us a little bit about your business.
Well, thank you. Thank you very much for having me participate in this webinar. I'm really pleased to be here. So Angion was founded a little more than 20 years ago by Itzhak Goldberg, focused on a pathway known as HGF-CMET, which is an essential pathway in the body, and it's actually conserved across multiple species for enhancing the recovery of acute organ injury. And acute organ injury is a broad category of injuries, everything from heart attacks and strokes to burns to kidney injury from toxins. All of these things are acute injuries to organs. And the HGF-CMET pathway is an essential and early pathway involved in the recovery from those injuries. Angion has been involved in developing small molecule therapeutics to augment the activity of this pathway to enhance recovery of these injured organs. We are also, because of the expertise we developed in the acute organ injury space, we are also very focused on developing therapeutics to slow or halt the progression of fibrotic diseases like lung fibrosis and kidney fibrosis. Angion's lead program is something called ANG 3777. It is a small molecule that enhances the activation of CMET to ideally provide a more robust recovery from injury. We have 3 late-stage clinical trials ongoing, a phase 3 study in what's called delayed graft function, which is a form of kidney injury that occurs in kidney transplantation, a phase 2 study in acute kidney injury associated with cardiac surgery, and a phase 2 study in lung injury associated with COVID pneumonia. All 3 of those trials will read out this year. The COVID study, the lung study, should be by the middle of the year, and then sequentially the phase 2 AKI and the phase 3 DGF study. And then we also have our next program in the clinic, ANG 3070, which will be starting a phase 2 study in kidney fibrosis. And the company has about 65 employees plus around 20 consultants that are essentially full-time with the company. So it's been a very active, it's a very busy company. We've got a lot going on. I think for a company our size, pretty tremendous pipeline of really interesting programs in development.
That's a great backgrounder. Thanks so much, Jay. So my next question is for Greg. So, Greg, here we are in the midst of a really hot IPO market, and yet at the time you guys went public, we were in the midst of a pandemic and we were in the midst of or starting to recover from a recession. So what do you believe is behind these seemingly opposite trends in the markets? Why is the market so hot for IPOs and just financings right now?
Yeah, well, let me attempt to look at my crystal ball, but I think that what's currently causing the strength in the stock market is a combination of very low interest rates,
Mhm.
um, optimism that we're seeing the light at the end of the tunnel with respect to the pandemic, and accelerating economic growth as the world begins to return to pre-pandemic normalcy. With the market averages continuing to make new highs, IPOs have been getting done at a record pace, and especially in the life sciences sector.
Mhm.
It actually reminds me a bit of the IPO boom in the 1990s that
Mhm.
was associated with the waves of internet IPOs. These big booms have a way of seeming to appear overnight, but they're really a confluence of several conditions coming together at once. Back in the 90s, the internet had been gestating since the government began funding it 20 years earlier in the 70s to create a nuclear war-proof distributed communications network. PCs has evolved into cheap, ubiquitous communication devices, and networking standards and technology advancements gave rise to higher bandwidth global networks. So all this coming together, coupled with the robust economic environment in the second half of the 90s, enabled the boom. And
Mhm.
as a result, you saw tons of capital flowing into the sector back then. There were hundreds of companies that went public. And today, a little over 20 years later, a few have grown into some of the biggest, most profitable companies in the world, like Amazon, Google, Facebook, et cetera. So what I believe we're witnessing now is a very similar phenomenon related to life sciences, with its roots in the successful completion of the Human Genome Project almost 20 years ago, back in 2003.
Mm.
When the successful sequencing of human DNA was complete, it's led to a bunch of things, including genotyping of specific viruses to direct appropriate treatment. That we're seeing the fruits of that, today as we speak. Identification of mutations linked to different forms of cancer, and the design of medication and more accurate prediction of the effects of medication. Um, so with COVID dominating the global headlines for the last over a year, and the
Mhm.
mind share of investors and the incredible success of these various vaccines, notwithstanding the J&J hiccup of this week, they were developed in record time. There is, and I believe will continue to be, a spotlight on the life sciences sector for some time to come. And that means company formation and investment by VCs, and ultimately path to public market through IPOs. And the market's basically betting that 20 years from now, some of the most successful global companies will come, I think, from this crop of life science IPOs.
That makes sense. I get the cycles, right? Today's life science IPOs could be tomorrow's big pharma companies or whatever. So I totally get that, and that the market is betting on that, like you had said. So makes a lot of sense. So back to Jay. So Jay, why did Angion chose to IPO and do it the traditional way? What's the story behind the strategic inflection point in the company's trajectory that made you decide now is the time?
Great question. So biotech companies, especially biotech companies at our stage, are by definition just giant cash burning machines. They take enormous amounts of money and shovel them into the furnace and hopefully come up with valuable products. And so most biotech companies tend to have to raise multiple rounds of financing over time. And we had done that when I joined in May of 2018. We raised money that summer and then signed a partnership with Sinovant for Chinese rights to 3777, and then subsequently did some additional private financing. But when you're talking about a company that's in our stage and with the number of programs we have, the cash needs become quite significant. And so you have to think about what is going to provide us with a viable path to both raise the money we need in the near term, to fund the clinical trials we have ongoing to completion, but also give us future access to capital. The more successful you are, the more money you spend in the near term. As you have good success in some of these trials, you have to prepare for launch. You have to plan on future clinical trials for other indications. So the more successful you are, the more you're going to need capital. And being a public company is certainly still the most efficient way to raise capital for companies. So the thought was, in the long run, this is an optimal way to both provide for future financings, but also public companies tend to reflect good news and positive events into their stock price in a way that is more fully representative of the value creation than you might get on the private side. For us in particular, we signed a partnership with V4 Pharma in November of last year, which was really the catalyst for us to go public this year. But we had been talking about going public as early as the spring of last year before the pandemic hit. We filed our S1 confidentially in mid-February of 2020, and a matter of weeks later, the pandemic became obviously of crisis proportions and really slowed down some of the process for
And so
us.
that's my next question for you. So COVID hits, and tell us how that impacted your planning for the IPO. Walk us through how the change in market dynamics impacted your timing.
Sure. So we had filed in mid-February, and the plan was to get comments back from the SEC and then publicly flip and probably go public in the, call it, late April or May timeframe. When the pandemic came, at the time when the pandemic first hit, as you probably recall, people weren't that sanguine about what was going to happen to the capital markets. And as we were talking to investors and to banks, the view was that the capital markets were going to be shut down. Crossover investors said they weren't going to make new investments. They were going to preserve capital to make sure that they had funds available for their existing companies. A little bit like what we saw in 2008, 2009, when people retrenched and wanted to hold on to capital to be able to fund their existing portfolio. Relatively quickly, though, we saw that the market continued to be able to provide capital to new companies. And so we started rethinking whether we wanted to go public in the face of this. What we needed, though, either way, was we needed to enhance our finance capabilities, obviously, and that segues into how Greg joined us during the summer. But also, we wanted to either do a crossover round or have some other catalyst to be the driver for the IPO. And ultimately, that turned out to be the V4 transaction that got completed in the fall of last year.
Terrific, terrific. Thank you for that. So coming back to you, Greg. So you joined Angion, I believe it was late June, the summer of 2020, as Jay said, as their interim CFO. So tell us about what were your first priorities coming in, and then specifically, how did the pandemic and all of those attendant consequences around it change the IPO planning and preparation for the company?
Sure. Well, as Jay just, related the story, the company was already well along its path to IPO when I came in. So as soon as I came in, there were discussions about timing and what we needed to do to get ready, and when we were going to go, quite frankly. And so the first thing, as I sort of assessed the state of what was going on within the finance team and company's capabilities, were I had to address two material weaknesses that had been identified in the 2019 audit,
Mm-hmm.
that needed to be addressed immediately, regardless of when we ultimately were going to go public. And those two weaknesses were insufficient resources with knowledge and expertise in U.S. GAAP. And the
Mm,
second one was insufficient financial reporting and close controls, both of which I think are relatively normal for companies that are
absolutely,
moving at warp speed.
absolutely.
Um,
Common, very
you know,
common.
and especially in the life sciences sector, where most companies are pre-revenue and it's really about the science. So to address that, I brought in a finance team of consultants that I had previously worked with to augment the existing resources. I brought in a controller who was a longtime experienced controller, had worked in public and private companies in all of the various life sciences sector. I brought in a really talented FP&A
Hmm.
director. Um, who I'd worked with directly before in a previous medical device company. Brought in one junior resource, to really focus on journal entries and just execution, and then and we'll tell the story a little more. But as Jake said, we ultimately ended up going public early this year in 2021. So as we got closer to that, we brought in a technical accountant, SEC reporting specialist, to make sure not only were we able to have everything buttoned up for the S1, but then the 10K came, less than 2 months after we went public. So one of the very first things we did to get our arms around everything was to build a 3-year plan, which ultimately was the basis for the whole use of proceeds section of the S1, and was used to get both the underwriters and the counsel and the investors comfortable that, as Jay talked about, in a capital needs company, that we had a handle on how much capital we did need and how far it was going to take us. And of course, all of this was done on a virtual basis because there was no ability to gather physically, due to COVID. This was June through December of last year. So we leveraged a number of technology and system solutions to manage collaboration, like Asana. We implemented new internal control processes using Fraxion, Agiloft, Bill.com, a bunch of nuts and bolts systems. And we really leveraged the Microsoft Teams application to have multiple group and one-on-one meetings each week to get everybody on the same page and stress teamwork and communication. And as Jay said, the IPO was originally expected to go during the summer. It ultimately got postponed for, a great reason, which is the V4 deal that we consummated in November.
Right. And we're going to talk about how the IPO ultimately went in just a few minutes. But I wanted to get back to Jay for this question, which is that one of the elements of your IPO success story, which is so classic to life science companies, is your partnership with V4 International, which I understand is a Swiss-based large pharma. Can you kind of tell us a little bit about how that relationship evolved and why it became like the strategic nugget for you guys in terms of then moving forward?
Great question. So V4, we had met with them. We were introduced to them probably a little more than 2 years before we actually did the deal, and had originally met with them at the JP Morgan conference in San Francisco, and stayed in touch, and then re-engaged at JP Morgan in 2020. So we were talking to them in January of last year, having sort of started to reopen those discussions in the late part of 2019. What was both sort of funny, but ended up working out well in the end, was that we had this meeting with them at JP Morgan. They made the decision to start doing diligence in earnest. And then when COVID hit, normally these deals get consummated through extensive in-person meetings back and forth, crossing the pond for them to do diligence on us and for us to go meet with them and to negotiate it out. All of this got done virtually because after the meeting in January, things were shut down. V4, though, was an ideal partner for us because they are a leader in the nephrology space, and the 2 lead indications we have for 3777 are both kidney indications. And so they ended up being a great partner for their ability to commercialize this on a global basis, to integrate this into what is already an incredibly well-established framework for kidney sales. They obviously understood the markets very well and didn't need to get up to speed. So all of those things made them a great partner. Another thing that made them a great partner is because they were focused on the kidney and only the kidney, we were able to negotiate a structure for the deal that would have been unusual with a different large pharma company, where we were able to keep all of the non-kidney indications for the drug or for different formulations of the drug, whereas they are commercializing the kidney formulations. The reason this was valuable is not only did we get upfront money from them, significant back-end economics, they were also committing to making an investment into the company of ultimately $30 million, which became an anchor part of the IPO. And the validation I think we got from having a leader in the kidney space look at the work we were doing and say, we think there's a high probability of success, and we think that this is commercially relevant and valuable, obviously goes a long way with investors to proving that there's something here. Because investors have to look at a lot of companies, and they don't have the bandwidth or the expertise to look at every single company, every single product, and dig into
Absolutely.
especially areas where they're not experts already, like delayed graft function, where there hasn't been an approved therapeutic ever. So it's not a commercial indication that they would be familiar with without extensive work. So that was why V4 became so important to us.
It's a validation, and that
Mhm.
is very helpful with other investors. I totally get that. So Greg, from your CFO perspective, how did you think the V4 partnership impacted the foundation that you were building in terms of the financial story for the investors in preparation for the IPO?
Yeah, as Jay said, it was both a validation and a source of capital. But even beyond that, it allowed us to sort of fast forward through what's become almost standard practice in the life science IPO world, which was we didn't do a crossover round right before the IPO.
Mhm.
Typically these days, there'll be a round done, a private round with investors who invest both privately, and then will often follow up their investments in the public markets. And that's a form of validation in the sense that makes the investment banks feel comfortable. It
Mhm.
allows you, when you market the deal, to say, we've already got the money raised from existing institutional investors, so we're looking to round out the story. Um, we didn't do that, as Jay recounted, and we've been talking about. The timing of 2020 just got all mucked up, with COVID and doing the deal and everything. But we were still able to go and, we were one of the very few IPOs in the last 2 years that in the biotech sector that did the IPO without a crossover round. And as Jay mentioned, the clinical work they did, that imprimatur of a leading kidney company was valuable in telling the story and in shaping it the way we described it in the S1, et cetera. When we initially press released the deal in November, we didn't really disclose too many of the details. That was really V4's opportunity to explain to their investors, why they got involved. But then when we refiled the S1 originally confidentially in December and then flipped it in January, we had disclosed at that point almost all of the details of the deal. And those consisted of upfront and near-term dollars, including the investment. We were able to describe the amount and terms of the investment, post-approval milestones for the drug that we licensed to V's for, sales milestones on a global basis for when we ultimately got the sales, and the royalty rates that we were going to get from the sales. And that disclosure allowed us to talk about those details during the roadshow. And it enabled the analysts, both the analysts for the banks and the analysts who were, on the buy side looking at the deal, to build their own long-term models with more confidence than I would say they normally could. So that was a great help. And like I said, that $30 million in effect was a substitute for the money that often comes from crossover
And
investors,
crossover
because
rounds.
we
Totally,
already had
totally
that
get that.
money, headed into the process. The other thing it did from a finance perspective was the upfront payment that we received to them in November. It forced us to focus on revenue recognition, which the company had not really had to focus on that much in the past. And as we all know, with ASC 606, it can get pretty complicated. So it was good in the sense that we immediately started figuring out, okay, how are we going to recognize this revenue? How is it going to be reported in our 10K shortly after going public?
Mhm.
And so that involved a lot of work, and that's why we decided to hire this SEC accounting specialist, and also we brought in some other outside technical resources. So it was a great catalyst and feather in our cap to get the deal done, and then it was a little bit of more of a, I don't know, I would say fire drill, but it forced us to sharpen our accounting skills and get our act together too right away.
Totally get it. So, Jay, the Angion IPO was executed, I believe, on February 5th. Tell us what the results were.
Sure. It was, we were very happy with the results. We sold 5.75 million shares of stock, including the
Fabulous.
underwriter's over allotment. Am I on mute?
Nope.
Good.
Nope,
Sorry, I sneezed earlier, so I had to mute. I
no
didn't
worries.
disrupt everybody and wanted to make sure I'd gone up.
We're
So
good.
5.75 million shares. We priced at the top end of the range at $16 a share. So we
Fabulous.
brought in gross proceeds of about $117 million, of which
Fabulous.
25 million was from the concurrent private placement from V4, along with the shares of stock that we sold, which were 92 million through the IPO itself. So very, very happy with what that did for us when we raised the 117 million gross. That really was 2 years worth of capital for us. We had said at the time and continue to say that that would take us through the end of 2022. And we have a lot of catalysts between now and the end of 2021. We have 3 major clinical trials reading out this
Yeah.
year. We're reporting the results of another clinical trial. We're starting a new trial, and we'll probably start 2 or 3 new trials next year. So that cash gave us the confidence to really move a lot of things forward in parallel. That now we are going to be able to read out and reap the benefits from those trials reading out in rapid succession over the next couple of years, and hopefully filing an NDA for next year. So
So,
very
Jay,
happy with how that went.
it sounds fantastic. So the money that you raised with all that you have on your plate, and I know you guys have built out the plan, you feel that you've got it covered for the next 2 years.
We do.
Great.
And Greg can speak to this as the CFO. He can obviously talk about where we can go with the money. One of the things, and this goes back to one of the reasons why the V4 partnership is so valuable, is that we expect to have data at the end of this year from the phase 3 DGF study, and hopefully that will be the basis for an NDA filing next year and launch in 2023. One of the reasons the V4 partnership was valuable to us and was synergistic for them was that we were expecting to spend about 50 million between now and launch. So pre-commercialization costs were going to be 50 million just for that trial, for that indication. So the idea that our partner is taking on those expenses and already has a lot of that infrastructure means they're not going to be spending 50 million to do that, but they are able to execute on that in a successful way. So we were able to raise less money than we might otherwise have needed to raise if we had been going alone and had to spend all of this money at risk, so to speak, before you have an approval or before you even have the phase 3 trial results.
So I totally get why that partnership is so valuable to you guys. It makes complete sense. So I have one last question for you, Jay. So any last thoughts for our audience around if you were advising another CEO who's planning a life science IPO in this kind of crazy time, so to speak, any advice that you would want to share with them?
Sure. I think there's a few things. I think, the COVID specific changes are meaningful. I think we've spoken about, we've all talked about this in the past, which is that I think we were sort of fortunate. We did all of the S1 drafting, or the primary parts of the S1 drafting, in person, and got that done by February 14th for our submission. So when we had to revise the S1 in the future, that was done virtually, but it was a much smaller piece. I think the S1 drafting part being virtual is much harder than it has been in the past.
That's
On
what
the
I
other
heard.
hand,
Mhm.
the road show was dramatically better than I think the in-person road shows are, because you can do essentially back-to-back road shows, both for the TTW process and for the road show itself. You can fit in 10 or 11 or 12 meetings in a day because there's no loss between travel between locations or wasted time flying between cities. And honestly, we had, if we were doing this in a traditional way, in a non-COVID, non-virtual meeting setting, it would have been hard to get the IPO done when we did, because the week we were pricing, there was a big storm on the East Coast, as you may recall, that snarled up traffic in New York, made flights in and out of major cities very challenging or delayed or not happening at all. We might not have had half of the meetings we had if we'd been doing this in person, whereas since we were doing this virtually, that was very helpful. So I think when you talk about advice for CEOs and for others who are talking about going public, I think, one, obviously, really the more you can have your finances and your S1 buttoned up, the better, so that more of that can be done internally, and you're checking it in a group virtual setting rather than writing it. The second thing is I spend a lot of time getting used to how to present virtually and do these meetings virtually, because that, I think, will end up being even in the absence of the pandemic, I think that people are not going to go back to the traditional charter a private plane and fly from city to city in the same way that they had in the past. So I think it's really important to get used to virtual presentations, to being to having the infrastructure and so on, so that you can do that. And then obviously picking the right advisors, both financial and legal, are essential. I mean, we were very happy with the banks we picked. They played well together, and I think all of the people were very focused on getting this done in a timely fashion. But I do think that the key points I would bring up are related to COVID, which are think about spending more time on the S1 process, and think about the roadshow itself potentially being a little more. It's intense because you've got to, I lost my voice on a couple of different occasions during the
But
TV.
we're hearing that from a lot of clients who are in the midst of life science traditional IPOs right now, which is the S1 drafting process virtually is tough, tough, tough. But that the process of the roadshow virtually absolutely terrific.
Mhm.
And I would not be surprised if you're right. That's going to be the future going forward in terms of much more virtual roadshows. Absolutely. I would be surprised if we go back to the traditional way. Um, Greg, I have one last question for you, and it's really in the same genre, which is as a CFO, as a life science CFO heading into an IPO, any final tips from your CFO perspective?
Yeah, well, I would say, make sure you build an organization that's public company ready.
Mhm.
If you can, give yourself enough time and resources. In one sense, I was lucky because the V4 deal slowed things down enough to make sure that we had all our ducks in a row. Um, but the world moves fast, so you've got to make sure you can both properly execute the accounting and complete the S1. And like I said, the public filings are going to come at you very quickly. It's we had a 10K that we had to produce in basically 6 weeks, soup to nuts, and that was a lot. And we're not talking about this today, but in a lot of companies going through public through a SPAC, it tends to be even more intense because you don't draft the S1 on the way in, and so you haven't been through as much. I would say it really helped that Angion had an experienced, dedicated general counsel who was
Mm,
already there at the time that I got there, who, as Jay said, really captained the drafting of the S1, not just the writing, but all the due diligence circle up and everything that needed to happen to get things done. So to me, that's a must. If you're thinking a year out, get that GC on board
mhm.
right up front.
ASAP.
Yeah.
Mhm.
Make sure the IPO generates capital you need. So to do that, you've got to have a really robust FP&A capability, and you've got to build that 3 to 5 year plan,
Mhm.
as soon as you can, and it's got to be defensible.
Right.
Obviously, looking out into the future, a lot of things change, but investors care that the money they give you is going to get you far enough so that they can potentially reap the rewards of the positive news that's going to come.
Absolutely.
Right.
Mhm.
Um, you know, if you can do a deal like a V4, do it. That's obviously dependent to each company. If you can't, be prepared to do a crossover round. So start thinking about that. And those people are best not approached 2 weeks before you want them to give you money. You got to build those relationships ahead of time. And as Jay said, the IPO roadshow is in some ways much more efficient. There's no more planes, trains, and automobiles, but it's a sprint still. We had many days during that week where the meetings started at 6 a.m. and they ended at 5 p.m. because we were actually on mountain time. So we were doing East Coast meetings early and all the way through to the end. We were doing, West Coast meetings. And Jay did come close to losing his voice, and thank God he didn't lose it all the way, because me trying to explain the science, going on inside of one of these companies would have been a real challenge. But so make sure you're rested and
Mhm.
you're ready to go. And I think we mentioned this already. The S1, what makes it less efficient, you can collaborate, you can share drafts, and you can have online drafting sessions through Zoom or whatever it is. But there's something to be said for getting everybody in the same room and
Mhm.
forcing a conclusion, either
Mhm.
on the way you're positioning something within your prospectus, or circling your due diligence, or wording a sentence, or providing numbers that everybody signs off on, so you don't get caught in a loop where you don't know what version everybody's
Mhm.
commenting on. It's easier to do that in person. So if you do have to do it virtually, and you probably still will for some period of time, you got to have a clear captain and a tight focus on version control. And again, props to our general counsel, who I thought did a great job doing that.
I think those are great insights, and I cannot agree more that a great general counsel, particularly if they have sector knowledge
Mhm.
and have done an IPO before. I mean, they're worth every penny from the standpoint of helping you get through the process, particularly herding the cats in terms of S1 drafting. So
Mhm.
totally get that. So first, I want to say thank you so much for joining Jay and Greg for what I think is a very informative case study on taking a life science company public the traditional way. We do have time for a bit of chat. So I'm going to now go into the chat room and see if we have any questions. Right now we don't, but please, audience, if you do have questions for Jay and Greg, type them up and we will direct the questions right away. Let's give it maybe a minute or so to see if people do want to ask questions. I know you guys have questions out there. Come on. I'll just give it maybe another 20 seconds or so. Well, it looks like there's no questions. I think you guys did a great job in covering kind of all that people today need to know in terms of taking a life science company public through the traditional way, which was terrific. So thank you both for joining us. And on behalf of FLG, we very much appreciate all of you who joined us. And I just wanted to remind everyone that on April 28th, we'll be hosting a panel. FLG will be hosting a panel on board audit committee governance and effectiveness. So get on our website, sign up. We would love to have you participate. So again, thank you everyone for joining us.
Thank
Thank
you.
you.
Thanks for
Okay,
having
bye
us. And
now. Thank you,
I
Jay and Greg. Thank you.